So remember, I shared last week that pharmacology is one important part of the NCLEX, and it's important that you do well to do a detailed review in that area. So let's check out I showed it last week. Let's just look at it again. 13 to 19% of questions dedicated to pharmacological and parenteral therapies. So you cannot joke with pharmacology. Is a very high yield area. So that's why we realize that it's important that we do this review. So this is to help you have an idea. We went through last week, so let me quickly run through it. Areas you have to cover for pharmacology. It's important you know medication administration and safety, drug classification and prototypes. You need to know about them. Antibiotics and anticoagulants, psychiatric and pain meds, toxicity and antidotes. That if a client comes in and has had, let's say, digoxin toxicity, what do you do? What do you do? What do you give? Acetaminophen poisoning, what do? You have to have that on your fingertips. Then pediatric and geriatric pharmacology, pregnancy and lactation, drug interactions and interactions of drugs with food. And then common drug side effects and toxicity signs. So it's very important. Then you need to know some client teaching. So how a client will use inhaler, subcutaneous insulin administration, and all of that, you should review it. So yes, exam may seem very tough, but you are strong and you will be able to conquer it. So let's look at review 2. Let's start with this. So I will read it so we can save time, and immediately I start and you know the answer, you can drop it in the chat box and we will move on. So let's start with question 1. We have 10 higher questions that we want to review today. So let's start right away. So a nurse is caring for a client taking phenytoin. Which finding requires immediate action? So this means that you should know all about phenytoin. All the drugs we review today, do well to revise it inside out. So gingival hyperplasia, drowsiness, skin rash, nausea. So what's the answer? So this is about phenytoin. Which finding requires immediate action? Immediate action. So always ask yourself, what is this question asking? It says, which finding requires immediate action? So the answer is skin rash. Skin rash. Look at what the question is asking. Which finding requires immediate action? So you may have some of the side effects here pointing to phenytoin use, but which will require immediate action? The answer is C, skin rash. Remember that this rash may signal Stevens-Johnson syndrome or any other severe hypersensitivity reactions. So yes, phenytoin can cause the gingival hyperplasia, can cause rash. So it's important that you know what phenytoin can cause in a client. But this question is asking, which one requires immediate action? So that's why the answer is C. So it's about what will cause a lot of harm to the client in case you do not intervene quickly. Great. I hope we are all okay and there is no confusion here. So phenytoin, yes, can cause gingival hyperplasia, but the question is asking what will require immediate action. Great. So let's look at the second question. Which teaching points are appropriate for a client prescribed metronidazole? So this is a select all that apply question, and it says avoid alcohol during treatment. It means that we can choose more than one. May cause dark urine. Stop medication if metallic taste occurs. Finish the full course. Report any numbness or tingling. Which teaching points are appropriate for a client prescribed metronidazole? So let's go. Let's go. Select all that apply. So you can select more than one. And so which teaching points? You should know the drug inside out so that when you give it to a client, you'll be able to teach them what they should expect, what they should look out for when they are on that drug. So let's go. Can we get some answers? Put it in the chat box. Pharmacology is very important, so let's do well to take note of all the drugs we are reviewing today and do well to revise it inside out. Because it covers a higher percentage for the NCLEX. Let's drop the answers. Let's check this on Facebook. Anyone is in? All right, so let's check. Yes, so these are the answers. Check it out. A, B, D, and E. A, B, D, and E. So let's see. Okay, I got some answers here. A, B, E. Okay, wow, great. Yes, and D is also part. A, B, D, and E. So avoid alcohol during treatment? Yes. May cause dark urine? Yes. D, finish the full course. Very important. Then E, report any numbness or tingling. So it's very important you know the drug inside out so you can give your client education. So well done. A, B, D, and E. Great. So remember this, that you have to avoid alcohol when taking disulfiram, when taking metronidazole because of the disulfiram-like reaction. So take note of that, and it can give dark urine. Client should complete the course, and there is a peripheral neuropathy risk. So always remember this: for metronidazole, clients can have metallic taste. They must avoid alcohol. Their pee may become dark and they must finish the course. So do not forget this. Next question. Which lab results should be reported immediately for a client taking clozapine? Hemoglobin 13.5 gram per deciliter, white blood cell count 2005 per millimeter cube, blood glucose 102 milligram per deciliter, platelets 180,000 per millimeter cube. So you should know all about clozapine. So what is unique about clozapine? Okay, got some answer already. Great. Well done. Yes. So when you see clozapine, always remember agranulocytosis. The white blood cell will reduce. So any client on clozapine, you should know that they are at an increased risk for infections. So we have to check the leukocyte often for clozapine. Agranulocytosis. Well done. Next question. This is another kind of question where you are going to write the steps in the correct order. So in case you meet it in your exam, it will be some kind of drag and drop. So you drag the first one, put it at 1, second step, put it at 2, and all of that. So you should be used to these types of questions because always when you get multiple choice and select all that apply. You can have what we call the drag and drop. You can even have matching and all of that. So yes, you are instilling eye drops. So what will be the correct order? Wash hands, pull down lower eyelid, instruct client to look up, instill drop into conjunctival sac, and then close the eyes gently. So let's go. Let's write it. So write the steps. Which one should be first? 1, 2, or 3? Write the steps. Which one should be first? Okay, so the first is wash hands. Great. So this is the order. This is the proper sequence. It's even arranged for you. So let's see. Yes. So yes, you wash your hands. It's very important. Standard precaution. Then pull down the lower eyelid. So when you do that, you then instruct the client, look up. Then you instill the drops into the conjunctival sac, and then you tell the client to close the eyes gently. So just look at the order. Do not forget. Go through the process. Wash hands, pull down lower eyelid, instruct client to look up, instill drop into the conjunctival sac, and then close the eyes gently. So it's important that we know how we administer some medication. Remember, it's part of the course content. So how maybe you give insulin subcutaneously and all of that, how you do that. So do well to study all the relevant steps for drug administration. Great. Next question. A nurse is caring for a client on morphine.
That should be one.
A nurse is caring for a client on morphine. Morphine is very important. High yield drug. What should be monitored closely? When you hear of morphine, you should know what should be monitored. So select all that apply. So this is a select all that apply question. So we can choose more than one. But always remember, I caution you, if you select all that apply, be careful you are sure of the answer before you choose them, because if you choose more negative answers, more wrong answers, you end up not even getting the marks for the ones you got correct, because it will be +1 -1. So do well to choose with caution. So let's get the answers coming in. What is peculiar when you have a client taking morphine? Let's go. Let's go. Let's go. Let the answers come in. Are we there? Let the answers come in. So what should you monitor closely? Respiratory rate, level of consciousness, blood pressure, heart rate, and then bowel function. C and D, well, let's see. Remember, respiratory rate is very important because, yes, A, B, C, and E, but D is not part. Heart rate is not part. So A, B, C, and E. Because remember, morphine will cause respiratory depression. It causes CNS depression. It causes hypotension and constipation. So remember, respiratory depression, CNS depression, hypotension, and then constipation. So A, B, C, and E. So I always monitor for that. So always remember this as well. Monitor output, respiration, the pressure, and to have hypnosis, there's impaction, nausea, and then euphoria from morphine. So let's look at the next question. You have a child receiving methylphenidate. Which is the priority to monitor? So which client will be given methylphenidate? A child with ADHD. So you have this child with ADHD receiving methylphenidate. What will we monitor? Let's go. Height and weight, blood pressure, mood swings, and appetites. Mood swings and appetites. Always look at what the question wants from you. Priority. So what is the priority to monitor? What is the priority to monitor? Let's go. Let's get the answers coming in. Methylphenidate is given to children with ADHD. Okay, so we got B. So it's going to be 1. Yes. So it's A. Yes. It's A. Height and weight. So remember that it's a stimulant. So it suppresses appetite and it may cause slow growth. Very important. Slow growth in children. So remember, anytime we are giving methylphenidate to a child, we're going to measure the height and the weight. We need to monitor the child. Very important. So do well to read all about methylphenidate, the indications, the side effects, and everything about it. Very important. It's given in ADHD. Okay, next question. A patient with TB on isoniazid reports tingling hands. What's the nurse's action? Reassure the client, discontinue the drug, notify the provider for vitamin B6, and then reduce the dose. Reduce the dose. So what is the answer? Let's go. Notify the provider for vitamin B6. Yes. Remember that peripheral neuropathy is common. It's common. So B6 will help prevent that. So always remember, if you have a client on isoniazid, always remember that the client can have peripheral neuropathy. So vitamin B6 will prevent this. So anytime you see isoniazid, remember I see nerve issues, so the client will need B6. Which drugs require therapeutic drug monitoring? Select all that apply. Lithium, vancomycin, digoxin, metformin, and warfarin. Select all that apply. Yes, yes. So we got B and T, and then A, B, C, E. It's important that you know this. So it's A, B, C, and E. Well done. Well done, everyone. Remember that if you have a drug which has narrow therapeutic index, there is a high risk of toxicity. So that is why you should know about therapeutic index. So lithium, vancomycin, digoxin, and warfarin. You always have to monitor these drugs closely. Next question. So, which medication must be taken on an empty stomach? Which medication must be taken on an empty stomach? Levothyroxine, metoprolol, furosemide, or omeprazole. Let's go. What's the answer? There's so much we have to know when it comes to pharmacology. It's important that even for all these drugs, you should know the kind of class that they belong to, the side effects, whether they can be given with food or on empty stomach. Always look out for what the question is asking, whether it's select all that apply or is a one answer question. So this is a one answer question. So it's levothyroxine. Remember that levothyroxine requires empty stomach for absorption. So I'm thinking this question should be a select all that apply, because for omeprazole, we give it about 30 minutes before food. So if you went for A and D, you are correct. Okay, A and D is correct for this question. I hope we are all good with no confusion. A and D, yes, silver. A and D. So omeprazole is taken on empty stomach about 30 minutes before eating. So let's look at the next question. So always remember, even for level, leave food out. Do not forget. So let's look at the last question. A client is prescribed gentamicin. Gentamicin is a drug that you must know inside out. Which lab results must be monitored? So you are giving a client gentamicin. What should you monitor closely? Which lab results should you monitor closely? Let's go. This one we should all know it. I have seen, I have. So let's see. This is a must know. It's creatinine. Anytime you hear gentamicin, know that it has nephrotoxicity, okay? And sit down. It has nephrotoxicity. So always remember that you have to check the kidney function, okay? Do not miss this. This one is, NCLEX is testing how safe you are. So you should know that it is nephrotoxic and you have to monitor the client's kidney function, okay? Very important. Gentamicin, GFR risk. So always remember. So as we have gone through these questions, I think it has exposed the fact that it's important that you learn pharmacology inside out. So that is why we will want you to join us for our upcoming pharmacology crash course, which will help you cover all the important areas needed to put you a step ahead when it comes to pharmacology. So feel free to register. I'll drop the link again. And if you have any questions, feel free to drop in the chat box.